Hello and namaste all. We have been studying these diseases, and the next in the series is a disease called Shwasa. So let's see. So Shwasa, basically, what is Shwasa? The disease in which there is difficulty in breathing or shortness of breath is called Shwasa. So difficulty or shortness, inhalation, exhalation becomes difficult or it is short, like that. Okay, so that is Shwasa. According to Ayurveda, Shwasa or dyspnea or breathlessness, Kasa and hiccup are interrelated conditions. They have identical etiological factors and site of origin. So, as you studied Kasa, now we are studying Shwasa, hiccup. Maybe later, as you study, you will realize that the causative factors or the hetu uh, for these three diseases are quite similar to each other because their origin is in the same place, that is pranavaha srotas. Okay, pranavaha srotas is the origin for all these diseases, and they vitiate the pranavaha srotas. Hence, anything which vitiates, be it food, be it behavioral lifestyle, which vitiates pranavaha srotas, uh, becomes a causative factor for shwasa or kasa or hikka. Okay. So primary Shwasa. Now, primary Shwasa, secondary, what is it? I'll tell you. Primary is the disease, and secondary is a symptom, as we discussed about Kasa also in the previous lecture. So, primary Shwasa, wherein Shwasa will get manifested as an independent entity or disease. The disease will have its own set of Hetu, Samprapti, and Purvaroop, Roop, treatment, etc. Okay, so that will be primary Shwasa, which is a full grown disease in itself. And secondary shwasa, which occurs as an effect of some other disease. Shwasa will be a symptom or a premonitory symptom or a complication or a sign of bad prognosis of another disease. Okay, so the treatment depends on the treatment of root disease, primary disease, which is at the backdrop of shwasa. So what does it mean? As we saw in Kasa, similar applies to Hikka also, the disease whenever you study next. Applies to Shwasa also. Shwasa is a independent disease in itself, and it can come as a uh, symptom or a premonitory purva roop or uh, roop or complication, upadrava, or arishta of some other disease. So that will be secondary shwasa. Okay, and when it is secondary shwasa, we cannot give, we should not, our aim should not be to treat shwasa that time or breathlessness or dyspnea that time. Our intention and aim has to be treating the root disease or the primary disease. Only then shwasa will subside. Okay, only then shwasa will subside. So here what we are learning now is shwasa as a primary disease. Okay, and it has its own set of, as we will see, hetu, samprapti, etc. So what we are learning now is going to be primary shwasa or shwasa as a disease. So what are the types of shwasa? Mahashwasa, urdhva shwasa, chinna shwasa, tamaka shwasa, and kshudra shwasa. All are different than what we have been studying as the types of diseases in the previous diseases. These are they have their individual, um, uh, I won't say existence, but typical feature or characteristics. Okay, so what is Mahashwas, Urdhva, Chinna, Tamuka Shwas, and Kshudra Shwasa? We'll see in the next slides. For now, we should know that Shwasa is of 5 types. Okay, so hetus and causative factors or causative factors of Vasa. Exposure to dust. Okay, so you have seen Kasa, now you are seeing Shwasa, and as I said, will relate to Hika also in future. Not all will be same, but similarities will be there. So exposure to dust or dhuma, exposure to smoke, exposure to strong winds. Okay, will be a causative factor here. Living in cold places. So cold weather, living there or being there for some time in cold places. Excessive consumption of cold water or cold fluids. Consumption of cold water and cold fluids. So aggravation of vata and visheshan of pranava srotas will happen due to that. Vyayama, excessive physical exercise can lead to shwasa. Excessive is, we've discussed on this, beyond one's physical capacity and on a repetitive basis. If that is done, then can lead to shwasa. Excessive indulgence in sexual activities, excessive walking, it can go in Vyayama also. But Chankramana, basically, previously in old ages, it was not done as a exercise. Walking used to be a part of their means of transport. Mean going from one place to the other. Walking was one of the main ways, means of traveling. So excessive walking, hence excessive walking has been considered here separately. Nowadays, walking is been told as a part of exercises. So previously in old ages, it used to be walking for going from one place to the other for work or for any other activity or for some purpose. Ruksha Anna, excessive consumption of dry foods, aggravation of vata will happen. Viruddhashana, consumption of incompatible food. So here, when we see causative factors, they are one, vata aggravating, second, pranava srotas vitiation, and third, we are also seeing um kapha aggravation with srotorod. Kapha aggravation with srotorod. So we'll see because of cold, excessive cold exposure, water or fluid or uh, climate. Okay. So additional hetus or causative factors, excessive accumulation of ama. So for any reason, ama uh, is present in the body or presence of ama in the body or formation, accumulation of ama in the body will be a causative factor towards shwasa. We know ama is formed due to what all reasons. Excessive dryness of the body. Okay, so excessive dryness of the body is can be due to langhana or less intake of food than what is expected. So I have 10 units of hunger, but I eat only 5 or 4. So that is less than what is required or less than my capacity. So people call that as fasting. Now, if you have to understand through an example, crash dieting in weight loss management, many places we've seen that people are advised crash dieting. Don't eat food, eat only little food, etc. So okay, the consumption of the stored fat, the digestion of the stored fat is no doubt going to happen, but the patient will not understand when to stop because the next step is vata aggravation, right? So that can cause excessive dryness in the body, rukshata. Excessive fasting, langhana, we already saw. Long standing debility. So if the patient has kshaya or dhatu kshaya for a long time, then that can lead to Shwasa. Marmaghata, injury to vital areas of the body. We briefly saw this in one of the previous lectures. Marma is the vital points on the body where there are, if those get damaged, then that can cause uh, pain, severe pain, or debility, part debility, or severe debility, or even death. We saw that briefly. So those are vital points. 108 points are there on the body which are identified and then differentiated into various categories of what will happen as after the trauma. So according to the effect of the trauma on the body, they are classified into different types of marmas. So marma ghata, ghata is trauma, injury to the vital points or vital areas of the body can lead to shwasa. Now, in this case, uh, vital areas or marmas in the kapha region or chest ura region of the body will be considered more in shwasa disease. Shodhana ati yoga. We saw a yoga, no vague of vomiting or vamana in Shodhana. We saw in Visarpa. Here, Ati Yoga is more Vegas or more times the patient does Vamana than expected. So the dosha has fallen out completely, but the remnant of the medicine is still there in the koshtha, in the body. Hence, the feeling of vomiting is there, and the patient keeps vomiting more. So, in that, the amount of the vomit or the vomitus is less. However, the vegas keep happening. Okay, the tendency of vomiting keeps happening. So that is ati yoga of shodhana. In that, what happens is depletion of dhatus and aggravation of uh, doshas certainly happen, and in ati yoga more so there is aggravation of vata. Okay, and in shodhana, especially in vamana ati yoga, we can see aggravation of vata. Atisahara can lead to shwasa. Jwara, fever, can lead to shwasa. Chardi as a disease or vamana as shodhana panchakarma can lead to shwasa. Now in chardi also, if the vegas or the tendency of vomiting is more, only then it will lead to shwasa. Pratishaya again is a disease of the upper respiratory tract, uh, especially the nose. So running nose or rhinitis, if you have heard of it has similarity with pratishaya, in which there is difficulty in breathing because of the blockage in the nose. Hence, shwasa can be seen as one of the uh, pratishay. Long-standing pratishay can lead to shwasa. Additional causative factors, hetus urakshata, injury to the chest. We saw this in the marma ghata point also. So marmas which are in the chest region or in the kapha region, when there is injury to that, it can lead to shwasa. Now, without marma also, I mean, apart from marma also, if there is urakshata or injury to the chest, it can lead to shwasa. Dhatu kshaya, depletion of the tissues for any reason, be it langhana or malnourishment or due to crash dieting, etc. If there is dhatu kshaya, then it can lead to shwasa. Urdhva Raktapitta. In Urdhva Raktapitta, long-standing Urdhva Raktapitta, shwasa can become a disease. Udavarta. Udavarta is Sanskrit terminology for pratilomata, pratiloma gati of apanavayu. Okay, so when we have seen this in Malavashtambha also, apana has downward natural movement in the downward direction. Natural movement in the downward direction. Now, for various reasons, because of holding of natural urges, for not passing motion for a long time, due to excessive dry food items, the it is difficult to pass motion, etc. So, for whatever reason, Apanavayu gets stuck, obstructed, its natural path gets obstructed, it attains the upward direction. It attains the upward direction. So it becomes Pratilomagati. Anulomagati, natural flow is in the downward direction. Against the natural flow is Pratiloma direction. So here Apanavayu attains the Pratilomagati in the upward direction, because of which there is obstruction or less tendency of retention of urine, retention of stool, uh, many a times anartha, that is no menses, also happen in Udavarta. So those are those things together will be termed as Udavarta as a disease. Okay, so in Udavarta, basically for you to know what happens is it Apanavayu will take Pratilomagati or Urdhogati. Okay, and then next things will follow up to the respiratory tract. I will discuss that in the Samprapti. Okay. Pandu or anemia, it can be related to, and the other liver disorders, Shwasa, it can cause Shwasa. Vish or poisoning can cause Shwasa, asthma or breathlessness. Pinnaka, residue left after extracting oil from sesame seeds. Pinnaka, we have seen this as a causative factor in Amla Pitta, in Rakta Pitta, in Visarpa also. Pinnaka is there. It is one of the causative factors for Pittaja, Visarpa, even if it was not mentioned in the slide, but yes, it is one of the causative factors for Visarpa, Pittaja, Visarpa, Pinnaka. Residue left after extracting oil from the sesame seeds. So sesame seeds, when they are crushed, oil will come. Oil is extracted. Whatever is left is called pinnaka. Okay. So paste, sesame paste without much of oil is pinnaka. Tila tela, excessive intake of sesame oil. We saw this in the previous couple of diseases that tila uh, tila seeds or sesame seeds are ushna, very ushna and tikshna. Hence, they have a tendency to vitiate, aggravate pitta. So, be it seeds or tila oil, sesame oil, or pinnaka, all these three will have similar kind of effect on the body because of its ushna tikshna nature. Pishtana, taking flours in excess, okay, floury foods, so fine flours, breads, and various uh, food items which are made of fine flours will can lead to shwasa. Few more hetus or causative factors. Vishtambhi ahar. Okay, Vishtambhi ahar means foods which cause constipation or which have a tendency of constipation. So Vishtambhi ahar is something which food items which will hold the stool, hold the stool. So it has kind of uh, I won't say grahi action, but similar to grahi action. So it will cause stambhan. Okay, example is fine white flour. Okay, white flour. Maida it is called in Marathi. So that white flour, many bakery products are made out of that white flour. That has a tendency of Vishtambi ahar. So because of that, it absorbs the what do you call, the fluid part, the mm, unctuous part in the body. So that will become more and more dry. So it will, even if it absorbs the fluid part, it doesn't become soft. It because it has tendency to absorb a lot of fluid, it will keep absorbing it, and it becomes sticky and sticks to the walls of the pakwashe or the colon. Hence, it becomes difficult to evacuate. Though that is called as vishthambi ahar. Vishthambi ahar. So foods which have tendency to cause constipation is called vishthambi ahar. Vidahi, corrosive food items, we know. Guru ahar, heavy to digest ahar. Anupa meat, flesh of aquatic animals or animals which stay in marshy lands. That is heavy to digest because of presence of more apadhatu in the meat. Hence, it becomes heavier to digest. Curd, yogurt, heavy to digest. Milk, milk and milk products. So a lot of milk products get made nowadays. We see. I mean, for ages we've been seeing that. But milk, as it uh, is heated more and more, it becomes more and more heavier to digest. More heavier to digest. So as the water content in the milk reduces, it becomes more heavy to digest. So the condensed milk, uh, food items, sweets basically are made out of condensed milk. So that becomes very heavy to digest. And if it is consumed on a regular basis in higher quantities, it can lead to ajirna, agni-mandya, and kapha prakop and shrutarod, etc. Abhishandi ahar, we know what is abhishandi ahar. Complication of cough, chronic cough. So here, when a cough, kasa, is chronic, persistent for a long time, so it creates constriction of the trachea or the windpipe. So because of the constriction, there is difficulty in inhalation, exhalation. Okay, so that can lead to shwasa as a disease separately. So after seeing all the hetus, causative factors, let us understand the samprapti. It looks a bit different in presentation compared to what we have been seeing till date. So hetu 7, it leads to seven. So exposure to uh, the lifestyle of hetus or consuming hetu foods. Three things happen. Vata prakopa, pranavah srotas dushti, विशेषण of pranavah srotas, विशेषण of annavah srotas, and udakvah srotas also. Okay, so three things happen due to with their various hetus. Annavah, udakvah srotas dushti will happen, vata prakop will happen, pranavah srotas dushti will happen. So when all these three happen together simultaneously, one after the other, or one vitiates the other, and these three things come together, then Shwasa, disease gets formed. So when Annavah Srotas and Udakvah Srotas Dushti happens, uh, there is vitiation of Kapha and Ama gets dislodged. So Annavaha and Udakvaha Sroto Dushti when happens, it will lead to Kapha vitiation and formation of Ama. Okay, on the left hand side, if you see on your screen, left hand side, you will see Annavaha and Udakvaha Srotas Dushti, which will lead to vitiation of Kapha and formation of Ama. In the center, you will see Vata Prakopa, aggravation of Vata due to various causative factors. On the right hand side of your screen, you will see Pranava Srotas Dushti, vitiation of Pranava Srotas will happen. Now, what happens is this Vata Prakopa, aggravated Vata, will disturb the Pranavaha Srotas also. Okay, how does it do? When it vitiates the Pranavaha Srotas more, it gives dryness to Pranavaha Srotas and creates constriction in the windpipe or in the Pranavaha Srotas. Okay, let's not call it windpipe, let's call it Pranavaha Srotas. So, because of Vata Prakopa, Vata will go in Pranavaha Srotas, will create Rukshata, will create dryness, and also will create constriction in Pranavaha Srotas. So, Pranavaha Srotas, every Srotas is a lumen, okay, for flowing. Now, in Pranavaha Srotas, what flows is prana, oxygen for us. So, because of aggravated Vata, Rukshata increases and constriction happens in Pranavaha Srotas. That Rukshata and constriction leads to obstruction in Pranava Srotas. Okay, so imagine the lumen of Pranava Srotas was this much, which would carry, say, 2 units of prana in one expiration or one uh, inhalation. Because of Rukshata and constriction, the lumen, the bore became narrow, and because of that, the flow of prana got obstructed because of the obstruction or constriction in the lumen. Okay, the body needs 2 units of prana, but because of the constriction, less oxygen or prana is going inside. Hence, there is insufficient prana to the body because of the constriction, and breathing happens rapidly because anyway the body needs oxygen. So when you need oxygen, what do you do is you either deep breathe or you deep breathe rapidly. Okay, so in Pranava Srotas Drushti, this is the channel. In Annava Srotas and Udakva Srotas Drushti, Kapha vitiation happens and Ama gets formed. Now, the aggravated Vata also dislodges the Kapha, vitiated Kapha and Ama, and brings it to the Pranava Srotas. Okay, so because of Kapha vitiation and Ama formation, Srotorodh will happen. The Srotorodh will happen, the channels will get blocked. We know that Ama, presence of Ama and aggravation of Kapha uh, has the potential of blocking the channels. And when there is Vata Prakopa also, the aggravated Vata will not sit in one place, it will keep moving. So one place it goes to Pranava Srotas, vitiates Pranava Srotas there, creates Rukshata and constriction. Sankoch is the Sanskrit term for constriction. And on the other hand, the aggravated kapha and ama, it dislodges from its place to create srotorod. And because of the presence of ama and kapha and the constriction, there is more obstruction in the pranava srota. So imagine that the lumen was this, because of vata, the constriction happened, it became this. So from 2 units of prana, the potential or capacity became, say, 1.5, okay, because of the constriction. And now imagine that kapha, aggravated kapha and ama create a, uh, how do we say, covering inside, from inside the lumen. So the lumen further becomes constricted. Okay, further becomes constricted, and then the capacity becomes, say, from 2 to 1.5 to 1 unit. So imagine, because of this constriction and obstruction, prana, which the body was wanting in its normal form, was 2 units. Because of pranama constriction, it became 1.5. Because of kapha and ama presence, it became 1. So the requirement was 2 and it came to half. Now there is insufficient prana supply to the body. Hence, the body is rapidly breathing, trying to get more and more oxygen. Imagine yourself, say, one block one nostril, close the mouth, and try to breathe. After some time, you'll realize that you need more oxygen. So you start taking more breathing. Similar happens with the patient also. Because of the obstruction, there is severe discomfort uh, to the patient. Hence, the patient tries to take in more and more oxygen. Now, this is a very, how should I say, complex structure of symptoms and signs. Hence, we see varied types according to how the patient is breathing and what other signs and symptoms are seen. We see Mahashwas, Shudrashwas, Chinnashwas, uh, etc. So, in the Samprapti or pathogenesis, we see Hetu 7 happens, Annavaha, Udakavaha, Srotas vitiates, Vata Prakopa happens, Pranavaha, Srotas is vitiated, and the aggravated Vata further causes vitiation of both the Srotas, all the three Srotasas, creates obstruction and constriction in the Pranavaha Srotas. The lumen of Pranavaha Srotas gets decreased considerably, and there is lack of oxygen or prana supply to the body. Hence, the patient has to breathe more rapidly and intermittently in order to suffice that as a requirement of oxygen. Okay, so this leads to the disease called Shwasa. In Purva Rupa, premonitory signs and symptoms, what is seen? Parashva Shula. Parashva Shula is pain in the sides of the chest. Parashva is the side. Parashva is the side of the chest, of the rib cage, side of the rib cage. Okay, that is Parashva. Why will that Parashva happen? Because of strenuous exercise of the lungs. What is the strenuous exercise? Why is the strenuous exercise happening? Because I wanted 2 units, but I'm getting 1 unit, hence I'm working more. So the lungs, the salary of the lungs was $2,000. It was reduced to $1,000, so it is working in double shifts. So just to make you understand. So its requirement is $2,000, but because its salary is reduced, it is working more. Okay, so it definitely will have more fatigue, and because of that more work, Parashvashula, pain in the side region, will be seen as a Purvaru, pain in the chest region, pain in this region also. So the entire region, rib cage, where the muscles are present, which will help in constriction of the chest, expansion and constriction of the chest, expansion and contraction of the chest, will uh, go in fatigue or will start showing pain, difficulty in breathing. Difficulty in breathing is a very obvious Purva Roop. Annadvesh. So Annadvesh happens due to presence of ama and vitiation of kapha, aggravation of kapha. Annadvesh. Annadvesh means anna is food and dvesh is not feeling like eating. Okay, so food is kept in front of me, but I don't feel like eating. Is that's annadvesh due to presence of ama and aggravation of kapha. Aruchi, again same kapha and ama. Increased flatulence. This is due to indigestion. And Vishtambi Ahar, we saw in that we saw the how do, Pratiloma Gati to Apanavayu. So increased flatulence will be due to indigestion and blocking of the Apanvayu in the abdominal cavity. So even if it is increased flatulence, it will be with force. The flatulence will happen not very naturally, it will happen with force. Okay, the patient will have to strain to release the wind. Admana, distension of abdomen, naturally because of pratilomagati of apanavayu and indigestion, there will be the vayu, the vata will get accumulated in the abdomen. and because it is not naturally being excreted out of or thrown away out of the body through the anal region, it gets accumulated in the abdomen, which causes abdominal bloating or distension. That is called as admana. Rupa. So now we are seeing specific signs and symptoms of each types. So Mahashwasa. Strenuous, painful inspiration with loud noises or sounds which are audible. Now here, this is quite typical of Mahashwasa, where Maha is big, basically. Maha is big. So uh, the the severity and intensity of this type of Shwasa is more. Hence, it is called as Mahashwasa. So here, strenuous and painful inspiration. Inhalation becomes painful and very strenuous, obviously because of the constriction with loud noises which are audible. So if somebody is sitting close to this patient or in front of the patient or in close vicinity of the patient, they can hear that the patient is trying to breathe, or his breathing uh, attempt or effort is heard by the people around. Patient breathes in with difficulty at all times. Till the time the constriction is there, the patient will have major difficulty in breathing. The breathing pattern is compared to hissing of an intoxicated bull. So, if you have heard a bull hissing, similar kind of sound. So, when it is auscultated with a stethoscope, wheezing, rhonchi, those sounds are heard on auscultation with the stethoscope on the chest. So breathing pattern is compared to hissing of an intoxicated bull. Body is, again, this is used as a simile, okay, for us to understand how uh, that pattern would be. So a lot of similes, as I have been saying, a lot of similes are used in the classical textbooks for us to make us understand things easier and in a better way. So a color could be compared to a flower, the smell could be compared to something, the taste could be compared to something, the look, shape could be compared to something, just for us to understand, okay, this is a red lentil, okay, so the shape of a red lentil, okay, kidney bean, okay, so this is shape, this could be the shape of the kidney. So to improve our imagination and imagining power, these similes have been told, and when we actually see those in the patients with presenting symptoms, we really feel confident that, oh, okay, whatever is mentioned, I am able to uh, relate to it in the patient. Okay, so similes. Body is depleted of aeration, obviously, because of the constriction and the narrowing of the lumen of prana or srotas. Oxygen or prana depletion, or uh, less prana is seen. So whatever action and function of prana is there in the body, all that gets depleted. So body is depleted of aeration, I think is a very shallow term. Whatever oxygen does to us in the body, everywhere we see that the work or the functioning is impaired. So impairment of functioning of presence of oxygen wherever required, it is seen. Okay, so patient loses focus from the present. Now, about depletion of aeration, we'll talk again. Patient loses focus from the present, obviously because his focus is completely on taking oxygen. Imagine yourself going in deep into the water without an oxygen cylinder, and now you need uh, desperately need to inhale oxygen, or you need oxygen, and the scuba diver says, okay, look at that beautiful fish, or look at the whale, or look at the corals. You would say, go to hell, I want to go and take oxygen for myself. So here, the other person may feel, instead of looking at the coral and beauty and scenery here, why you are going up to inhale oxygen. So here, because your focus was not seeing the beauty, it was taking oxygen, which is required for my basic needs and functioning in the body. Hence, the patient also loses focus from the present because his need and requirement to survive and sustain is oxygen. Correct? So, his focus completely is on taking the oxygen, right? Or prana, we should say prana. Furthermore, in Mahashwasa, improper perception or deceptive perception of vision. So, because of the prana, now prana, whatever functioning prana has, here we will see impairment and disturbance of functioning everywhere. So, the patient would see various signs and symptoms due to less prana in the body, improper perception and deception or deceptive perception of vision, abnormalities, deviations in the eyes and face. The face will start looking, I won't say pale, but uh, dull. It would start looking dull because prana, oxygen, will give that a feeling of completeness, even if it is happening involuntarily for us. We should thank God that it is involuntary. If we get focused in something and forget to take in oxygen, I mean, we'll be left with nothing. So, uh, thank God it is involuntary. So when it is happening, that time the focus is on everything what you see around. Your focus is there. Your eyes are focusing on something. Your thought process is focusing on that. But when there is lack of prana, you will see all these disturbances, abnormalities, or deviation in the eyes and face. So looking most of the patients, when you are breathing in deep, so most of the patients in Mahashwasa or various types, apart from Chudra Swasa, many patients have a presenting uh, symptom or sign where the patient is looking upwards in the upward direction. Okay, in order to breathe more and more oxygen, he is focused in this manner. It keeps happening. So this is in the active stage when the problem is happening that time, when there is no or the symptoms have subsided, his or her functioning is not normal, I would say, but near to normal. But when it is in the active stage, when I am the patient is having that breathlessness attack, I should say, that time these things will be seen more flared up. Abnormalities, deviations in eyes and face, baddhamutrata, obstruction in urination. We saw this because of the pratiloma gati to apana vayu. There will be baddhavarcha or obstruction of urination. So uh, the tendency to pass urine will be less. The tendency to pass stool will be less. So there will be constipation and obstruction to the urination because those are the functions which come under the purview of Apanavayu. And Apanavayu itself has got Urdhogati. Hoarseness of voice, of course, because of this is related to Prana Srutas. And there is severe obstruction or constriction of the lumen of pranamasuruta. So naturally the normal voice which the patient has will not be heard. There will be hoarseness of voice. In fact, in some cases, voice becomes feeble, goes deep, and becomes very difficult to talk also. So in further slides, we'll see that. Hoarseness of voice, helplessness. Helplessness, pretty obviously, I think you can understand why that helplessness, because they desperately need help in getting the oxygen, but because they are not able to do it to the fullest extent, they feel helpless. Okay, because there is nobody else who could help in that case, and they are also not able to help themselves. So in severe cases, I'm sure you must have seen, or you must be knowing, severe obstruction, there is tracheostomy, or there is intubation which is done, or oxygens are given for the uh, proper supply of oxygen. So that helplessness is due to lack of oxygen, which the patient is not able to take, or required amount of oxygen which the patient is not able to take himself or herself.
One question.
Mhm.
If apana is then obstructed, how about the menstruation? Is it affected as well?
Yes, it will be affected, because see, menstruation will be either scanty menses, less menses, or no menses, or it will be irregular periods. So it will be disturbance for sure. So it won't be normal as it happens in regular cycle. So the cycle will get disturbed, one. So there will be delayed menses, one. Second, whenever it happens, it will be scanty menses, which is less amount. Third, it will be painful menses, because uh, uh, the natural tendency is to let the blood out, but because there is pratiloma gati to apana vayu, that um, letting out that blood also becomes a very heavy task for the body. So first of all, it is more of scanty menses, but whenever it happens, it is dysmenorrhea or painful menses. So whatever comes in the kshetra, or the functional region of apana vayu will get affected. Okay, so in okay, now that reminds me of a query which Dore had asked about Pindiko Dveshtan. Pindiko Dveshtan in Malavashtamba, right, Dore? So that happens. I read that text also. Now this is out of context for that, but just to answer your query, Pindiko is the calf region. Okay, we saw that it is the calf region, and it falls under the functional category, functional area of apana vayu. And apana vayu is impaired in Malavashtamba. It has got pratiloma gati, correct? Mala, stool, are parthiva. Okay, it has parthiva mahabhuta, or prithvi mahabhuta in it. And what are the other areas in the lower part of the body in apan vayu kshetra which has more parthiva? It is Maunsa. Okay, so Maunsa, the biggest, or in the lower part of the body, these are the actively functional muscles. While walking, these will be working more. So there will be pain in this region because of more Prithvi Mahabhut. It has a resemblance of Prithvi Mahabhut in Mala and Maunsa. So there will be pain in Pindiko Dveshtan in Malavashtamba. This is the reference I could find because of resemblance of Prithvi, earth element in the stool, and earth element in the muscle. Okay, and because these are significant muscles in walking, hence there will be pain in these muscles. Okay, to answer your query, the previous query, Dore.
Oh, thank you.
uh, yeah, so where was I? uh, where did it start, Dore? What was the last point? Why did I take this? Mm,
You're talking about menstruation.
question.
Okay, retention of urine and yeah, the menses thing which you asked. So this is the region of Apana Vayu, and because it is in the upward direction, hence whatever is in the functional area of Apana Vayu, or the functional purview, we should say, it will have impairment. So not only related to the stool, menses, and urine, baby also. So if there is Shwasa, patient with Shwasa will have very difficult delivery process. So majorly most of the patients, they have to undergo cesarean section for delivery. So the normal delivery becomes very, very difficult. Okay. So and that is there. And in few patients, we also see difficulty in walking and joint pain, because in the lower extremities, basically due to the functional area of Apana Vayu. Okay. Fair. Urdhva Shwasa. Imbalance between Hillary, I'll continue this for 10 more minutes, then we'll take a break. Okay.
Okay, when the slide finishes, we'll finish.
Yeah, we'll take a break that time. So Urdhva Shwasa, imbalance between inhalation and exhalation of air. So there will be imbalance. So the amount which gets inhaled, so there will be imbalance. Less coming in, more going out, more coming in, less going out, etc. So it will be difficulty in breathing, be it inhalation or exhalation. Okay, so because it, as I said again previously, because it is involuntarily happening for us normally, we don't realize the importance of inhalation, exhalation, or we don't even realize how much amount went in, how much amount went out. Unless there is a balance, I mean, when it is normally happening, there is essentially a balance in inhalation and exhalation. Hence, we do not feel any kind of disturbance in breathing. But in this, because there is constriction and narrowing of the lumen, there is a imbalance between what comes out and what goes in. Dirgham Shwasati, deep and prolonged inspiration with difficulty in expiration or throwing out the air. So here the patient has to take a lot of effort to take in the breath and also has difficulty in throwing out the air. So sometimes the patient also has difficulty in throwing the air out, expiration. Okay, so you will see patients doing difficulty, lot of effort in taking in, and lot of effort in taking throwing the air out, because the constriction, the narrowing of the lumen is both ways, on both the sides, taking in also and throwing out also. Okay, so the amount of effort required in taking in almost similar will be required to throw it out. Okay, Dirgham Shwasati, deep prolonged breathing. Urdhva Drishti, eye deviated upwards. So I showed you in the previous Mahashwasa also. So when somebody is trying to, natural look is upwards. Natural look is upwards. Okay, so in these patients, we will see as a sign that eyes are in the upward direction. Now this is more in the active stage. Active stage, when they have unfavorable conditions around for that attack, that time they will have these signs and symptoms will be seen more. Okay, irregular eye movements, fainting or loss of consciousness due to pain during breathing, or during breathing basically. Dryness of mouth, many a times, I mean 95% times, whatever is inhaled through nose may not be sufficient. If there is obstruction, many patients try to open their mouth and breathe. Many patients, 95, more than 95%, I should say, apart from Kshudra Shwasa. So they keep their mouth open for breathing, assuming or praying that when I keep my mouth open, maybe I'll get more oxygen. So in that, they keep the mouth open, and dryness of mouth is seen as majorly in Urdhva Shasa. We can see that. Or the non-specific pains. Pain for no reason will keep happening in the body. Discomfort, confusion will be there. Discomfort because of lack of oxygen, and confusion, again, prana has that function of proper thinking. Okay, so your focus, your attention is more governed by prana, presence of oxygen. But when there is discomfort, the entire focus is on breathing, and confusion, state of confusions keep happening. They're lost from the present. They are cut off from the present during the active phase, is what is observed. Unconsciousness can happen, feeling as if darkness or blackouts. Uh, this is one of the symptoms which patients keep telling, especially in tamak shwasa, blackouts. So the tendency of blackouts in front of the eyes is there in Urdhva Shwasa, more in Tamaka Shwasa. Okay, so this is one sign which is seen here as well as in Tamak Shwasa. Okay, so that is Urdhva Shwasa. Next is Chinna Shwasa. So Hilary, if we can take the break now and come back after 10-15 minutes.